Welcome, everyone. Good afternoon or mid-morning. All right. As people are logging in, I am going to jump into housekeeping just so that doesn't take up too much time. So welcome, everyone, to today's ILNet Intentional Community Outreach webinar. My name is Mary Kate Wells. I use she, her pronouns, and I am the program director at the National Council on Independent Living. Nicole is a partner with the ILNet Training and Technical Assistance Center, sorry y'all, and we support the coordination of these webinars. And so today I will be the moderator. Today's presentation is brought to you by the Administration on Community Living at the U.S. Department of Health and Human Services in conjunction with the ILNet. The ILNet is operated by IRLU in collaboration with Nicole, April, and University of Montana. On the next slide, there is the logos of all of those our organizations. A few notes on accessibility for this webinar. Captions are available if you click show subtitles in your Zoom menu, and that will turn them on. We also have captions running on an external page. The link will be in the chat where you can adjust the font as the cart font as needed. ASL interpreters are also present today and should always be visible. If you cannot see the interpreters, please let us know in the chat and we can help work with you directly. We have Spanish interpreters available today. In order to access that, you can go to the Zoom bar on your screen and choose the language you'd like to hear the presentation in. Final note, we have public chat is turned off, but you still are able to chat with panelists. We ask that you reserve the chat with panelists for requests for technical support only, and you can submit questions in the Q&A box. We welcome questions throughout the webinar today, but we will be answering questions at the end of the webinar. To enter a question into the Q&A box, you can click Q&A and type your question in that box that comes up. You can also email me at mary-kate@ncil.org, and I will put that in the chat. If you're on the phone, you can press *9 to indicate that you have a question, and then select, when you're selected on, press *6. All right, so we're gonna get started. Just adjust my screen. Thanks so much for joining our conversation today about intentional community outreach. This is both for CILs and SILCs, so we hope to see some SILC folks out there. We do always like to give a little reminder about evaluations. We hear you. We heard your feedback to try to shorten the housekeeping while still maintaining all the necessary accessibility information. So we do listen to your feedback. So without further ado, today we have two really awesome speakers, Liz Sherwin, the Executive Director of the Illinois-Iowa Center for Independent Living, and Vicki Landers, the Founder and Executive Director of Disability Pride Pennsylvania. And myself, for a little change, I'm going to be sharing a little bit of information on the outreach requirements for CILs and SILCs. So let's get started. So I wanted to start with why we have this title of intentional community outreach. At first, we were talking about authentic outreach, but after conversations with our amazing presenters, Really thinking of the role of CILs and SILCs in outreach to our consumers. And it's more than just being authentic and developing relationships, but it's also being intentional, having a purpose or goal in mind when we're doing outreach, because I know all of us are trying to make sure that the consumers we serve are representative of our communities. So that requires work, right? So on this slide, it says intent defined. So intent means to have in mind a goal or purpose, or to design for a specific use. So when we're thinking about community outreach today, we're really thinking about your specific communities, your specific consumers, in your staff and board. So intentional outreach, like all IL services, is informed by consumers and the needs of your community. And so we're really going to emphasize that today of is the work that you're doing reaching the folks that are in your community. All right, but we also know that each community has different needs. So on the screen there says all communities have different needs based on, and there's a list of different things. Some of these items might be more relevant to you than others, depending on where you're coming from. But some things that you might want to consider is, what is your geographic area? What languages are spoken in your community? What racial and ethnic backgrounds make up your community? What is the social economic status of the surrounding community and counties that you serve? What's the age demographic, right? Are you targeting your outreach for the whole lifespan, right? Because we work with people with disabilities from birth to death, right? Also, residential status. Do you live in a college town or a city that has a lot of commuters? Do you also have work in communities that have large migrant populations or immigrant populations? So just thinking about really who's making up your community. Something that might be important is religious and faith affiliations. Maybe not for some folks. Disability type, and also other disability service providers, right? Is there a really, some states, I used to work at a center in Boston, the Boston Center for Independent Living, and there was a very active deaf program that helped or did our IL services for the deaf. So what other resources are there for the different types of disabilities? And then technology access. We know that not everyone has access to internet or other technologies. So just being mindful of, if you are using online platforms, or that there's a need for internet, that you're just mindful in that your outreach practices, and so much more. Right, there's probably 10 to 20 more things that I'm, didn't include here, but this is just to really get you started to be very intentional in your community outreach. All right. So other outreach considerations, really our focus right now is just to kind of spark some questions that you can use to explore your outreach practices. So some of the questions we put on the slide is, where is your CIL located, right? Is it accessible by the train or public transportation? Or how can consumers get to your center? What is your CIL environment like? One of our speakers is going to talk about that and give some practical examples of how your center environment can really impact the outreach and also the consumer input, right? Are your staff and board representative of your community, right? Are you providing resources and information in the prominent languages in your community, right? Getting the really specific information so that all your information is getting to the folks that need it. Some other questions, what age groups are you targeting in your outreach? Do you have youth specific outreach material? Do you have nursing home transition and say home modification on specific material? Just being really mindful of what what age group you're targeting with some of your outreach material. What strategies do you use to engage consumers? Something to think about. What community partners do you interact with? Are your outreach practices and material accessible for cross-disability, multicultural community? This is a big question to ask your center and when you're thinking about your outreach practices. And today we're going to focus a lot on making sure when you're considering your outreach practices that it reaches a cross-disability and multicultural audience. So transitioning into what is the outreach requirement for centers in statewide independent living councils. So we just wanted to provide a little bit of information on what is the regulation, what does the law say that centers and SILCs have to do in terms of outreach. This is very high level and not all inclusive. But what we pulled is the key areas of the law that talk about outreach. You can see other training on the IRLU page that goes more into specifics. But so CIL standards. So the CIL standards, the law says that CILs must work to increase the availability and improve the quality of community options for center independent living in order to facilitate the development and achievement of independent living goals by individuals with significant disabilities. So one of the CIL standards is that making sure that we are letting community partners, our consumers know what is available, but also what might need to be improved. So outreach is very important to that. Second CIL standard, the law says that CILs must conduct activities to increase the capacity of communities within the service area of the center to meet the needs of individuals with significant disabilities, right? So learning what areas of your center, maybe using some of those questions that we put up on the slide earlier, where is your capacity? Are you able to translate material if the predominant language, is Spanish or Vietnamese or another language, right? So seeing what is available and then really doing some internal work to make sure that you're able to meet those needs. And then in the CIL assurances, the law says that CILs must conduct aggressive outreach to individuals with significant disabilities who are unserved and underserved. I know this is a tricky one for folks because it's not necessarily defined, unserved and underserved. Usually that's within your state's bill, statewide plan for independent living. And really coming together as in your IL network to identify what those populations look like. CILs are also will receive training on how to serve unserved and underserved individuals with significant disabilities. So one example is we're hoping this of many different trainings would be benefit to CIL staff and SILC boards and staff members to get that education piece. All right, so now just to give an overview of the SILC duties, we just pulled out two specific ones. So the law says that SILCs must follow a federal process for developing the state plan for independent living, right? And so the SILC indicator for this is SILC gathers public input for development, monitoring, reviewing, and evaluation of the spill. The SILC assurance, it says SILCs actively consult with unserved or underserved populations in urban and rural areas, right? So we all know that, you know, SILCs are required to follow the process of developing the spill. A huge part of that, and I'm sure for the folks that have been attending Paula's TA calls, is public input. How do we hear from consumers and make sure that their voice is represented within the state spill, right? And part of that public input is how do we reach those individuals? How do we let them know that, hey, we're doing this process and you can be engaged, right? A lot of that has to do with our outreach practices, and using our outreach practices to ensure that we get a representative public input from our communities. The second SILC duty, the law says that SILCs must coordinate activities with other entities in the state that provide similar services to or complementary to independent living services. So the SILC indicator is that SILCs will recruit and vet potential members to provide recommendations for eligible appointments to the appointing authority. And the SILC assurance is SILC actively consults with unserved and underserved populations in rural and urban areas. So this kind of follows the same logic, right? If we're trying to recruit members and learn what the capacity of the state and the IL network is, having those community partnerships, which we're going to hear from Vicki Landers, one of our speakers about this, really to see what's out there so that your outreach can be really intentional and informed, and it helps the SILC, you know, find potential members that are representative of their community. And I believe I am going to hand it off. So that just is is an overview of some of what the law says, but what does that look like in application, right? So I'm going to hand it over to Liz Sherwin. So Liz, if you want to come on camera, and she's going to share a little bit about her center and the work that she's doing and their community is doing. So take it away, Liz.
Good afternoon, everyone. What I'm going to do is talk about some of the successes we've had with our center, because we represent a very diverse population. Part of the center serves a rural area, and the other part serves the urban areas. And one of the interesting things about us is that we serve 2 states. But in terms of the populations that we serve, they're mostly equal. In Iowa and Illinois, they're basically around a little over 200,000 people in both states, and we serve 3 counties in each state. How this happened, I have no idea. This started prior to my being at the center. But what has happened is that it has made us look at different ways that we are able to serve the rural as well as the urban population, as well as navigate between both states, Illinois and Iowa. And your question probably is, where in the world is the Illinois-Iowa Center? Well, basically, we are along the Mississippi, and we're divided between Illinois and Iowa. And if you look at the map, of the Mississippi going south to the Gulf, we're at that little area. There's a bump where it runs east and west. So my center actually is located in Rock Island, Illinois, and it is south of the Mississippi, if you can envision that, which is probably complicated because it took me a while to figure that out. But one of the issues that we had to do was figure out how we were going to serve both populations. So first of all, we had to figure out, well, who are the people that make up our populations? We realized that there were quite a few people that were in rural areas and urban areas. When we first started, we were able to reach and serve people in urban areas a lot better than the rural communities because there was a lack of transportation in many of the rural communities. So we had to figure out, hey, how are you going to get there? What are you going to do? What are the things that are needed to make sure that we are reaching these populations? In fact, who are the populations in those areas? So we worked with a lot of the planning organizations and other areas in the counties and the townships and other governing bodies to identify actually who the population was. And what we found that the majority of the people in our area was white. In fact, around 80% were white, and the rest were minorities, and they were located in their communities. They were in areas a lot of times that may be very socially economic issues with housing, with transportation, with healthcare, and many other things. And in fact, a lot of people, even the whites and the minorities, had no idea what independent living was. The concept of independent living was alien to them. And I still believe that in many populations, people really don't give a damn, I'm sorry, about independent living. What they want to know are what centers can do for them and how we are going to improve their lives. So our mission was to identify what these individuals needed or what they wanted or what their interests were, and try to work with them and be partners with them on how we could work with them and get them to identify with independent living and some of the opportunities that independent living and the whole concept of consumer control could bring to their lives, how they would be able to advocate, how they would be able to work within the systems that exist, whether it was government systems or social systems, and actually the structure of how their communities work to improve their lives. Currently, with us working in those areas, in fact, when I first started, I had no idea what a Center for Independent Living is. I'm hoping that we don't have that problem now because I started with my center almost 30 years ago. And when I came to the center, I was looking for a job. I'd gone through a messy divorce and I needed income. So I saw where there was a job application, and I came in and I thought a Center for Independent Living was actually along with nursing home lines until I got there. And I realized that there weren't beds, people were not, in a nursing home setting, but it mostly at that time was an idea, a concept that people with disabilities had rights. They should make their decisions for themselves. And so that is how I came to independent living. And one of the mandates back then is when the I guess you could call it, when the powers that be were looking at services provided by VR and agencies that serve people with disabilities, there were a lag in the services that they provided to minorities and others. So one of the things that we attempted to do in Illinois was to look at, since we had such a diverse population, of course there's Chicago, but there's the rest of us. So how do we reach these people, and how do we provide services? How do we let them know that we're out there and available? So back then we started a whole group of centers in Illinois with varying needs, varying populations and whatever, to figure out how we were going to reach all these different diverse populations and geographic areas. And so we found that in all those areas, there were key things that were necessary for us to reach these people and provide services. The first thing was you needed to know who the people were that were in your service community, whether you were working with a predominantly majority population or whether you were trying to identify those pockets of individuals that were minorities or whatever, or even had differing disabilities. Because we found that many of them were kind of isolated in their own communities, and they had no concept of independent living or what it was about. Therefore, we had to meet people where they were. One of the things that we worked to do was to increase the number of consumers, or CSR, that we were serving, whether they were minorities or whether they were white or whatever. So we actually went to the census data to find out what our community looked like. We found, like I said, that the majority of people were white, but there were other minorities. And these minorities included the Latino community, as well as African Americans. And then there was a spattering of Asians and others. So are we going to try to create brochures or information where all these people can understand what we're doing? One of the first things we did was look at, in these minority populations, who are the majority? And we found out that African Americans and Latinos were the majority population. So one of the first ideas was to make sure that our material was in Spanish. After this, we also neglected to, I guess you could call, vet the Spanish, because apparently the original brochure was written in a language that was equipped for people with college degrees. It wasn't written for just the average Joe on the street. So we had to deal with that. And once we got that corrected, when Latino people called the office expecting someone in Spanish to answer the phone, we didn't have anybody. So we had to address that issue. So in turn, that brought on a staff person. It made us aware that we needed a staff person who was able to speak Spanish. And then we looked around, and there were individuals that were deaf in the community. We had a large population of the deaf, but one of the issues they complained about was not having sign language interpreters who were qualified. So we worked with them to address those problems. In fact, in the minority community, the original people that started the center had concepts about those communities. They felt that they were crime-ridden, they were whatever, I'm not sure what all it was, but we did not reach certain communities because we felt they were unsafe for staff to go to those communities or interact with those people. In fact, within the office, we had issues. In fact, that was called the N-word by one of the staff. So you can see where we were. And in terms of going and working within the communities, we had management that felt that if staff went out to those communities, then they may not be safe. But at some point, we reached out to the community and wanted to know exactly what their issues were and how we could help, and kind of introduce them to the concept of independent living. They did not necessarily understand the phrase, but they understood the possibilities and what are the things that we may be able to assist them with. And a lot of the things we did was when they had issues, we would partner with them and try to work on their issues and improve whatever the conditions were. For instance, if there was issues with housing, public housing, we would work with those individuals in those areas. If there were particular housing issues or whatever, we started at that time working with people and bringing them into the center. At that time, and even now, there are certain areas of the community that don't have certain technologies to use. They may not even have spaces to meet. So we opened our offices up for them to have access to our technology, to have access to our meeting rooms. And if there were specific things we could do, maybe they were having an event, they did not have the capabilities to produce their material like flyers or whatever, we would use whatever we had, our copiers, our printers, or whatever, to assist them. And after working with these groups, we were able to identify with the people that were in these groups and in these organizations and agencies as someone that they could count on to at least assist if needed. And in turn, they understood that independent living and the types of services that we could provide to them, like advocacy, peer counseling, information and referral, whatever, were things that may be useful. In fact, in one of the very rural counties, they had no way of identifying all the service providers that were in the county. So the school systems and other places, if there were issues going on within the school system and they needed to identify resources for their individuals, they had it wrote down on business cards or whatever. So in one area, I think one of the most rural counties, Mercer County, in the Illinois side, we actually helped them develop a human service directory for their county. And in that directory, there was a large thank you with our logo indicating that we were responsible for that happening. So that was a way of outreach, and that was a way of getting our name out to people. we found out that in many areas, because of the ruralness of the areas, they had things called human service councils. That was the way that they kind of worked together to ensure that people were served, even though they were rural and services was out, very limited. They would work together to make sure that people in their areas did have the services they needed. So we joined those councils. We participated in them. If they were having specific events, we joined them. And at some point, we realized that this was a help to us in our provision of services and reaching people. So mainly what we've done and what we've been able to do is reach out to people. In fact, we have been able to reach people and get the staff outside our center and to go to areas where they may not have been comfortable going. Because one of the things and I'm not sure how it is with other centers, but with our center, we had a problem with staff getting outside the office, because you're not going to serve people if you just sit in your office and expect them to come to you, because that's not going to happen. You're going to have to go out and engage in communities and work with what is there. It just depends on who's there and how you work with them. And you have to become part of the community. You cannot be standoffish and not a part of the community. And the community have to feel that you're a part of their community. And you do that by engaging them and participating and always showing up and be a part of what the community is doing. And then in turn, the community will come to you and participate and feel that you're a part of whatever is going on in the community, and you are a place where they can count on for support, and in turn, they will give you support. And one of the things that we've done when we were actually looking at how we were going to serve our community, we looked at the main areas where there were gaps in services. In our area, mainly, one of the major ones was transportation. Another one was housing. And there were several others that we were able to work with, because in terms of, I'm sorry, that's my cell phone. That happens sometimes. But basically what we did was looked at all the people that were in our area and try to identify people that we could work with. And we worked with the transportation providers. In Illinois, as we had already started working on areas that had to do with outreach to our diverse populations, we worked with them. And since we worked in Illinois, there was, at that time, there was an association of Centers for Independent Living. Of course, Iowa is less populous than Illinois. Therefore, we only had 6 or 7 centers at the time that were working in Iowa, whereas in Illinois, we have 22 centers to help support us. So what we did was work with the centers as well as the Independent Living Council, and we did that in both states. We worked with whoever was out there to kind of get an idea and get some training and get a vision of what we needed to do in order to serve people. In the end, it wasn't easy, and it was not a slow process. It took us a while to bring independent living to very rural areas, and it's still difficult in some cases. We're not perfect, but the issue is that we found that in order to serve people, you have to be where they are, and you have to meet them where they are. And we found that the whole use of acronyms and all that sort of thing in delivery of services does not always work. And we had to bring them to the concept of independent living, what it is and what it means and how it can improve your lives. And in some cultures, people are more apt to take care of their members. And in independent living, we talk about individuals with disabilities managing their own lives, but there are people actually out there that feel that they have to manage the lives of their people who may have disabilities. So you have to get beyond all those types of things in order to provide services. Currently, we've been able to do a pretty good job, but we still have issues, especially as it relates to rural communities and places where transportation is very difficult to get. It means that it's difficult for staff to get to those areas, as well as it's difficult for consumers to get to us. In fact, we have one central office, and that's located in Illinois. And the question is, if that center is located in Illinois, in one of the more populous towns, how are you going to reach out to someone in Muscatine, Iowa, or Clinton, Iowa, or whatever? So one of the things that we decided early on was that we need to make sure we had transportation available for our staff to reach these areas. And we had to figure out how we were going to serve people in those areas. One of the things is we partnered at one time with the Vocational Rehabilitation Office, and they allowed us to have office space, maybe one day a week, to actually meet consumers and work with them on different independent living goals. We worked with different other organizations, and they allowed us to have space one day a week at their office, and we would go in and we would work with consumers. In fact, in one of the rural communities, they actually allowed us to have office hours once a week, and they would actually schedule consumers to come in to meet with us, which was not a bad thing. But the issue here, and what I'm trying to say, is that your engagement in your communities can take all forms. And basically, as I said, you meet the consumer where they are. They could be anywhere. It does not make any difference. The issue is centers have to make themselves available and engage in these communities. And it is not a situation where you do it once and consumers are always going to be there for you. It is a situation where you continue to work with your consumers and your communities to identify things that you can do that will make sure that you are part of the community, that you are continuing to reach out and work with individuals. In fact, consumers may have the same types of disabilities, but they may have varying needs. We found that in many areas, consumers have issues with housing. And housing can take many forms. One could be the effect that housing is just not there. Another could be the issue that housing is there, but it is not accessible. And then the whole issue of whether the housing is affordable. And these are all issues that you can work with consumers and work with them on how to advocate for and improve these conditions. In one community, when they are trying to develop new housing, we've even wrote letters of support to funders. And we've attended meetings where people were planning how they were going to increase the housing stock in their communities. And we always bring the issue of disability to those meetings so that if they're going on, they understand that they should not only talk about housing, they should talk about the issue of accessible, affordable housing. So there's any number of areas where you can partner with people to improve situations for people with disabilities.
Hi, Liz, you're sharing so many great examples, and I know you have some more in your slides that folks can view. We need to make a little transition just to stay on time, but if you wanted to wrap up before handing it off to Vicki.
Yes, that's fine. Mainly, I think I've probably gone over everything I needed to.
Okay, that works too. I just want to make sure I didn't want to cut you off if you're mid-thought. So everyone will have access to these slides. So I know there are a few that we didn't get to, but we're gonna please put questions in the Q&A box for Liz, and we'll have Q&A after we hear from Vicki. So thank you so much, Liz, and I'm gonna ask Vicki to turn their camera on and hand it to them. All right, thank you.
Hi, everyone. My name is Vicki Landers. I am Vicki first. I always tell everybody. I'm a disabled queer person. I use she, they pronouns. I'm a mom, a nonprofit leader. I'm also the Region 3 board member for Nickel. And I'm the founder and executive director for Disability Pride Pennsylvania. So why am I here? So I'm involved in the IL movement because of my amazing CIL Liberty Resources in Philadelphia County. I was living on the street, couch hopping, doing all of these things because of my mental health. And I was picked to do a research project by somebody in the mental health unit that I was in. And I got paired with the peer support group at Liberty Resources. And I started to go having one-on-one conversations with folks there, and found out that they had an art studio in the basement. And I am an artist, so I was able to go down, spend the day, work with people, get to do a lot of great things, and it really turned my life around. I am here today doing what I do because of Liberty Resources. They've helped me to find my way. This is why I run Disability Pride Pennsylvania now. They help me find housing. They've helped me with different types of supports and services. And I really feel like the Liberty Resources still really is, really saved my life. So I'm very much a part of the independent living movement. I support everything that goes on. I help in the ways that I can possibly do that. So I just wanted to kind of give you a little bit about who I was, because some folks are like, I'm not with the CIL, so why am I talking? So I just wanted to make sure you understood that. Next slide. So Disability Pride Pennsylvania. Some folks say DPP. I spell everything out because I'm not an acronym type of person. So we are a cross disability nonprofit organization, and that cross disability also is in our staff and our board. We are a very small, we started out, I should say, a very small organization that actually started with one of my friends who's a big part of the IL movement, Alan Holdsworth. He rolled down into the art studio one day and was like, hey, we need somebody to help us with signage and banners and all of the artsy things that needed to go along with this Disability Pride Philadelphia event that they were putting on. And so I, of course, looking for something to do, signed on. And I started working with him. We started to co-manage the event. And then 6 years ago, he turned it over to me so he could work on a disability equality and education bill and program. And so this is where we're at. I felt that I wanted to be here because we wanted to create space where all folks can have fun together. And you know, for me, it's where can we have fun? We have to remember to have fun. That's super important. We all have things that are going on, whether we have disabilities or not. But in the disability community, there's so much other things that go on that we have to remember to have fun and to celebrate our wins, whether they're little tiny wins like getting out of bed one day or huge wins. We have to be able to celebrate the fun. Next slide. So Disability Pride Pennsylvania's mission is, I always say it's disability pride is a movement. We're more than just a means of self-advocacy and a push for acceptance. Disability pride is above all a celebration of inclusion and disabled people who are proud of themselves. Our mission is to celebrate the pride that the disability community feels. It's a place for us to come together to celebrate the disability experience. And what makes our programming different from others is that we plan accessible community events to bring disabled and non-disabled people together. We want people to come out and have fun. We always have great resources because I believe that that's something that we always need to have. And I believe that bringing people together to socially kind of creates that space in fun ways to build stronger communities. Those communities have better conversations, and our programs provide spaces for advocacy, celebration, and some good trouble. Next slide. So I do a lot of work in the DEI space, DEIA for folks that need that reminder. But this was something, a definition that I really enjoyed and why I push for intentional outreach. It is through deliberate, well-planned public engagement, community members become informed about, participate in, and influence public decisions. Community members go beyond just knowing about a pending decision to participating in the decision-making process. They become a part of the community change. So that, like right there, that kind of resonated with me. Like, it made sense. It is why we do our work. We want folks to have an individual voice, let them help be part of the decision making in whatever that looks like. For me, advocacy looks like a large variety of ways that somebody can participate. And that's kind of what the way that we take to our outreach and to also our advocacy. Finding a space for everybody to feel comfortable, wanting to participate in whatever way it looks like to them. So we are, let's see, some of the programs that we have created through this is we have created cooking shows about what people are getting in like the pantries, what are people getting in their boxes. Lots of folks get a box here in especially Philadelphia County, and trying to figure out what they can cook out of the things that they get inside this box. So we wanted to start a place where people could get some recipes, give us recipes, because we would love to do a cookbook with folks' recipes and be able to share it out for everybody. Some of the other programs that we do are inclusive dance workshops, which is an amazing way for disabled and non-disabled people to come and learn how to move together, because we believe that everybody can move in whatever way that it feels like to you. Even if you can wrinkle your nose or move your chair around or whatever it looks like to you, people can still learn to move together. And it's a beautiful, beautiful thing. Slide 5. So disability community is the most diverse community. We all know that. And so for me, when I go into my work, all of my work, because I also do work on DEIA for a lot of different communities and organizations. You know, I always ask people, does your staff, does your board, do your volunteers, do the community members represent the disability community in your area? And this is really something that I started to talk about when I first learned about the Disability Pride Philadelphia event that was happening with Alan. I participated in the first one, and I thought to myself, well, if this is Disability Pride Philadelphia is not only a city, but it's also a county. Does this event really look like our community? And the answer was no. So I made it my mission to do outreach to all of the communities that we were missing. Still today, I have a goal every year that I reach out, at least let folks know about what we're going on. Not everybody may participate, but I want to make sure that we are getting out to as many people as possible. So through our work, we're reaching out to at least 30 new organizations every year. In Philadelphia County, there are a lot of organizations. Now that we're doing work across Pennsylvania, 30 organization doesn't really sound that hard, but it's finding those folks and involving community members across Pennsylvania as to help us figure out who we should be reaching out to in their areas. And that's how we started Disability Pride events, not just in Philadelphia, but across Pennsylvania. One of the other things I stress with folks when they're starting to think about outreach is to have a strategic plan, you know, and some of the questions that you can ask. What are your diversity, equity, inclusion initiatives? Do you have any? If not, I think that's the first place you really need to start. I think it's a huge problem if your outreach, if you don't have a goal and a plan, and intention in what you're doing. Slide 6. So for me, all of the conversations that I have across the state, I've done a lot of DEI conversations. And for me, DEI this is my take on it. Diversity is the look of what we're doing. Equity is the feel. It's how we want to feel, you know. And then inclusion is why we're doing this work. And if you want to add access, I say that that's how everyone is invited in to participate. Next slide. You know, I feel like as a disability organization, we should be the experts on the A in DEIA. We do add it in our outward facing organization conversations because they need to add that A because they have a lot of work to do to make sure that they're making things accessible. So one of my next things that I really like to talk about is how when I want to start an event, say Disability Pride Pittsburgh, which we are now in our 3rd year. We are talking about, we ask the community in Pittsburgh if they want to come to the table and they want to participate in the planning, learning how to do it, because our goal is that communities will learn how to do kind of the event planning parts of these things, and they know who should be there and they know what they want the event to look like. What we want is what I do is when I go in and I say, okay, here we are. This is what we look like, even if we're little boxes. Who is missing at the table? And I always say that if we could say somebody is missing from the table, then we need to stop. And we need to invite them in, and then we continue. So everybody's on the same page. We don't want to continue our conversations and then somebody feel like they're now trying to catch up. We want to invite them in so they're there from the start. They're helping out from the beginning. We also look at, like, are you attending events that are outside of the disability space? Those are great events to do. I really find that they're really fun. Some of the things that we're doing have just been amazing ways to connect to the communities outside of the disability space. So that way they're starting to include disability in their spaces. And are you going to networking events? You should. Next slide. One of the things I always talk about is, one of the easy things is, are you a part of the Chamber of Commerce? You should be in your area. It's an amazing way to get to know all of the organizations in there and to have conversations with them. Make sure you're asked diverse communities to come to your space, right? We always ask, come into our space, have this with us. But are you going out to their spaces? For me, we wanted to make sure we were being very intentional in what we were doing. We asked the Philadelphia Pride organization if we could participate, not just participate as like being there, but we want, and not just having a table, we want to see how we could help support the event in creating an accessible space. And so this will be our 3rd year of doing that. We run what they call the decompression zone, which is the sensory friendly space, which has grown into an amazing space. Last year, I believe that Pride had over 50,000 people that came, and we probably saw at least, I would say 500 people, if not more. We don't count, so there could be a lot more. But we're also providing this year, one of the things we want to do is provide that space for folks to still feel like it's Pride. So we're doing silent disco, which is an amazing way of incorporating that fun idea and also staying with the way that Pride looks. Do we partner with them on joint ventures? Those are things that we do at all times. Whenever somebody says, hey, would you like to partner and do something? We always say, obviously we say yes. Do you include them in important conversations? We need to include everybody in conversations, because if we want to get our point across, we want folks to be allies on our side, we need to include folks in conversations so that they understand why it's necessary, why it's important to us. Next slide. So here you are, some of my examples. Host the decompression zone at Philly Pride. We created Rev Up Philly Coalition. They're made up of disability advocates and organizations across Philadelphia and Philadelphia County to make change here in this large metropolis that we have. We're part of the local fair housing coalition. You should be. We always need to talk about affordable, accessible, integrated housing. We've partnered with the Academy of Natural Sciences to create an Outdoors for Everyone program, showing them how to make their events more accessible so folks can participate, but also creating some of our own and asking them to join us. And it is a humongous success. Next slide. Make sure that you're attending your local council members' fairs. That has really been a great piece of how we are building and strengthening our Rev Up voices. Provide spaces for community members to use their voice on stage. We know that Disability Pride Pennsylvania has the privilege of having a stage. So it is important for us to let other folks be the voices on our stage. Let them talk about what's going on. Make sure that we're looking at the representation that is going on stage, making sure that new voices get to be heard, young voices get to be heard. Yoshiko Dart asked me to make sure that when we do our Disability Pride Philadelphia events, something that she used to come to every year, that I make sure that I invite a young person to let them share their voice. That's super important to me. I make sure every year, and I do that across all of my events now. Next slide. So this, I told you about what Disability Pride is doing. The reason why we do it is that we are trying to connect with the local CILs to bring them to the table, to participate in the planning and the implementing the community events, to highlight their community work. A CIL person is always speaking on our stage during our events. It's super important that that happens. As a regional rep in Pennsylvania, it's necessary, and I believe that it should always happen. Next slide. And so I just wanted to thank everybody. Make sure that you're talking to folks in areas where you may not think of. HIV and AIDS, young adults, self-care, trauma, drug and alcohol, traumatic brain injury, diabetics, lots of unseen disabilities, and just be a part of the community. I find that sharing other folks' social media is bridging this community that I want to thrive in. So I want to thank everybody. You can always reach out to me at Vicki, VICKI, at disabilitypridepa.org. And thank you all for letting me speak today.
Thank you so much, Vicki. If you are on social media, check out Disability Pride's Facebook and Instagram. I know I follow them, and they're doing some really great, eye-catching, but also accessible postings. I saw you all had like a bird watching event this past weekend, I think.
Yeah, we had over 30 people join us.
Wow.
And it was a lot of fun. And now we're doing Happy Circuit Trails Day on the 27th. I have just so much fun.
Yeah, and I'm sure that brings in so many different folks from different communities and walks of life and everything.
Yeah, we found out there's an adapted birder group here in Philadelphia. There's
Okay.
all of these different groups that all basically came together for this event. And that's really what I want, One thing I did not tell everybody is about our event in Harrisburg. Do I have a minute just to sit?
Yeah, go ahead. Yeah.
Okay.
It's exciting.
So May 1st, Disability Pride Day at the Capitol in Harrisburg is an event that we're having. We're asking folks to come in from all over Pennsylvania, advocates, allies, workers, anybody who wants to come and join us. In the morning, we're going to have Capitol visits. At noon, we're going to rally at the front of the Capitol building, down at the bottom of it must be almost 60 stairs to the top, to the front doors of the Capitol building. We're going to rally. We're going to talk about different issues. At 1 o'clock, we're going to do a press conference where I will ask the governor to make the front entrance of the Capitol building accessible for all Pennsylvanians. So if you're in PA or you want to be a part of the day, we're doing our own Capitol crawl. Very excited about it. Everybody who signs up will be registered in a historical registry that we're creating. So just very excited.
Awesome. Thank you so much. And I'm going to stop sharing the slide so that and ask Liz to come back on video because we have some great questions. And Vicki, before we turn on, I think someone had a question is, what do you mean by good trouble? And I think the Capitol Crawl event might be one example of good trouble. Can you talk a little more of that?
Yeah, so, because we're advocates, I think that the Capitol Crawl is a perfect example of how you can do advocacy work. You can cause a little trouble for the folks that be, but you're doing it in a very non-violent. They're very, very simple kind of, this is what we would like. We're doing something that to show you how we feel. John Lewis was all about a little good trouble. So that's kind of where I love that comes from. Any way that you can shake up the universe.
Awesome. And I'm going to go into the Q&A. Liz, I saw you already answered some, but I just want to read them out loud and see if it sparks any other questions. So one of the first questions is, how do we conduct outreach to our underserved when we know we don't have the funds or human resources yet to be able to serve them? In other words, letting them know what CILs can offer them in services if they were able to reach them geographically. That is a good question. And Liz, I'm just going to read your response out loud for folks, but Liz put in the Q&A, we partner with existing agencies that allow us to use their spaces to meet with consumers and try to have days where we are at locations. Do either of you want to add anything to that? Or that is a tricky situation, right? Because we're needing to do outreach and engage, but at the same time, a lot of centers are strapped for resources and such. So, awesome. All right, there's another question in the chat. I agree with we have to go where consumers and participants are to serve them, and be a part of the community. However, SIL staff often themselves have disabilities and accessibility barriers. Some have to work remotely most or all of the time due to COVID or post-COVID illness. Some have transportation barriers with driving is the only option or the only feasible option, and they may not be able to drive or have the funds to do ride share, Uber, or Lyft. How do you recommend, or what strategies for reaching communities when your staff have significant barriers? And Liz, I don't know if you want to read your response out loud, or if you want me to, but if you want to unmute. Oh, we can't hear, if you unmute first.
One of my staff is blind. Therefore, transportation in many of the rural areas is not accessible, and there's no transportation, whether it's accessible or not. So she normally partners with another staff person who may be serving that area and go along with them. The issue of people that have mobility disabilities is very difficult. Many of those are able to work from home through remote, but the issue here is that a lot of the communities we serve don't have the technology where that can take place. So it is very difficult to reach those communities, and I'm not going to say it's easy. So we're still working on some of that.
Yeah, I know from my experience when I was working at a center, some of the options were, which I know this isn't an option in rural areas, but meeting at the library or common space or VR offices. So you just have to be very creative. And Vicki, I don't know, I know during COVID, you all did a lot of community events. I'm just curious how you all kind of addressed or engaged the community even through virtual events, if you could touch a little on that.
Sure. Wow. Yeah. So in March, right before COVID, we were planning our Disability Pride Philadelphia event. All of these great things were going to happen. We were going to do all of these amazing conversations and, parades and all of that. And when they said we were going to shut down, and that it extended more than that 2-week period that it was first thought we were going to do, everybody's like, oh, we're just going to shut everything down. Nobody's going to do anything. We can't have an in-person event. And I said, absolutely not. I said, disability pride happens. So we are the disability community. I think we all can figure out how to get online and how to still engage with each other. So it actually opened up this floodgate of all of these folks who now wanted to engage with the community. So we created Disability Pride Virtual PA. And we let anybody who wanted to come in and have conversations. We also made sure that we had a good mix so that it felt celebratory, but also good information. So we had everything from, we had an opening ceremony where we showed photos of old parades. We had Senator Harkin came in and spoke to all of us, a bunch of different advocates and local politicians came in. So it really felt like you're getting that parade feel during that. We had conversations around accessible, affordable housing. We had conversations on assistive technology. We had a stuttering night where we had a stuttering comedian and a stuttering singer, and they each performed, but they had a conversation about the stuttering community. We had nights where it was just games, just kind of how to figure out how to engage folks in making sure that we were doing stuff for as many pieces of the community as we can and bringing more folks in. So everything was on Zoom. Everything had captions. We had interpreters. We had print for those folks who needed it. And we ended up having 80 events in 30 days. The first year. The second year we did 30 events in 10 days. After I realized that 30 days was a whole lot.
Yes.
But
Well,
I kept
definitely.
people being engaged.
Well, with our center, we have a Facebook page and we do annual meetings and events like that. And we did our annual meetings virtually, and we've been doing it for the past 3 years.
Awesome. Yeah, so just using kind of all the avenues that we have available, and you know, I like to say the disability community is very creative, so we kind of figure out some solutions. Just going back to the Q&A box, someone asked, what is the best way to present this information about what Liz just spoke about to CILs supervisors? Is there any literature available outlining the recommendations in addition to the slides? And Liz responded in the Q&A box that she was willing to share personal experiences, and both Liz's and Vicky's email addresses are in the slides. But Liz, I wonder if you could talk a little bit, I know you did, about how really when you came into your center, it was a big culture change too, like within the center environment, to really get to where you are now. We have a few minutes. I wonder if you could talk a little about that.
Well, basically, when I started with the center, we were a center that I was, in fact, the only minority on staff. And the staff actually didn't understand how to interact with minorities. So, and I think I briefly talked about it earlier, being called the N-word by a staff person. So we had to get over that issue, as well as there was concepts about the community of minority people that we had to get over, because at that time, the director and some of the staff felt that they did not want their members out in these communities because they may be dangerous. So we had to deal with those issues. We had a number of issues that internally we had to look at in how we worked with the community, how we interacted with each other, as well as how we interacted outside of the office. So we actually had a planning session, or many planning sessions, where we asked the community to tell us how we looked and what are the things that we need to address. And once we accepted the fact that some of the things the community or the perceptions they had about us were accurate, we figured out how to work on those and how to address them.
I'm sure that was a tough conversation, but that we need to do that work.
Yeah,
Right?
it was quite painful at times.
Yeah. What would you have any advice say to the person in the chat about, maybe speaking to their supervisor of how they might approach, some of these internal recommendations?
Well, one of the things they could probably do is maybe just have a session, or the staff, I'm not sure how in our agency, we have staff meetings monthly with all the staff, and we can bring forth issues or whatever that's going on and discuss them that way. And if we need someone from the outside to come in and talk to us about different things, we can bring those in. And the staff in our agency runs the meetings. I do not set the agendas for our staff meetings or whatever. The staff are the ones that kind of determine what the agendas are and what the discussion is. And we all participate in the discussion, and if there are solutions or issues, then that is the way we resolve them.
Oh, I love that. That's great. Yeah, and sometimes it does take that outside person because they're kind of a neutral party and can facilitate a conversation. I'm just going to read the last question that Vicky answered in the Q&A box before we wrap up. And to those folks still hanging in with us, Joey's going to put the evaluation link in the chat. It will also pop up when we end this call. We do listen to your feedback, so please, if you have a minute to do that. But with the final couple of minutes we have, someone asked, any recommendations for affordable translation services for printed materials and ways to ensure the language is appropriate and accessible? Vicki responded, we partner with Language Services Office at the city. We barter with Spanish orgs and blind orgs for materials. I do a lot of access assessments as barter for services we need. That's interesting, Vicki. Yeah, just kind of, that reinforces that like a reciprocal relationship a bit. Yeah. Also, I know too, cities sometimes will have stipends or resources set aside for translation services, and just start building it into your budgets for any new projects. But awesome.
You can also reach out to some of the local colleges and universities. I know Temple here in Philadelphia actually has a language resource group that has helped us out.
Yeah, and something to, I think we're also mindful of is it's one thing that we translate the info, and I think the person who typed the question said that it's appropriate and accessible. So being aware of not all translation is equal, and making sure that it's culturally informed based on the language and the community you're translating for. So I just did want to mention that. Okay, well, Liz and Vicki, thank you so much for joining us today. I think this will be a great resource for folks to go back to. Folks will have access to the PowerPoint slides and recording. The link has been in the chat. If you take a minute to do our evaluation survey, we would greatly appreciate it. And just thanks for joining us, and have a good rest of your afternoon. All right.